The grapes of death, uveal dissection for scleral corneal and scleral donor tissue obtention, an anatomical approach. Crisis, economic collapse, global warming,
hurt myself,
farming collapse, migration,
to see if
desperation,
I feel
wrath, death.
focus.
But we can arise from the ashes of death and profit for the future. On a moonless night, we were confronted with the death of a young man. In this predicament, we were compelled to do better than usual, and this procedure came to mind. Is it possible to overcome the death of a youth? That particular night, we thought we could. The increasing number of techniques for scleral and corneal tissue transplantation demands the accuracy of the obtention procedure. An anatomical approach based in choroidal extrusion in order to obtain the scleral and scleral corneal tissue will be described. This surgical procedure allows the delimitation of sclera, choroid, and retina, and can play an important role in academical teaching and surgical training.
And you could have it all.
Once the ocular globe is obtained by enucleation from the cadaver, and following the standards of the European Eye Bank Association, we proceed by tightening it with a bandage surrounding the equator of the sclera of the eye. The next step is to proceed by cutting the sclerocorneal button with the surgical knife, leaving a margin of 2 to 4 millimeters from limbus. This last margin is advisable for facilitating its utilization in lamellar corneal transplantation techniques. The incision is completed with scissors. When the donor button is withdrawn, we can see the clock sphere-like disposition of the sclerocorneal junction. The extracted cornea is introduced in Optisol for some hours, and then is transferred to the tissue C medium to keep it warm. For step 3, with the help of a spatula or with the scissor blades, the anterior sclerocorneal junctions are freed in 360 degrees. Now, then we do a scleral incision that is perpendicular to the limbus and go on liberating the sclerocoroidal junction that easily separates in the anterior zone. It is in this area where suprachoroidal hemorrhages occur. Now a second incision is made, separated 180 degrees from the first. The incisions are made up to the equator. In the image we can see a long ciliary nerve. Step 5. Extrusion maneuver, from Latin extrudere, to give form to a mass by passing it through a specially formed opening. For that, we apply pressure to the whole circumference of the donor sclera to extract the contents of the ocular globe in its entirety, better said, choroidal globe. Here are identified several anatomic details: the iris, Schlemm channel, the sclerocorneal junction at the level of the inner scleral sulcus, the ciliary body, pars plana, ora serrata, long ciliary nerves. Step 6. Once the extraction by extrusion is performed, it can be seen how the sclera is attached to the choroid by its posterior zone. The sclera is passed through channels for nerves and vessels, as can be seen in this image.
If I could start again, a million miles,
The vortex veins are cut.
I would keep myself.
Then the short ciliary nerves.
I would find
The detachment of the sclera from the choroid continues with the help of the scissors. At this level, the lamina fusca can be seen. The lamina fusca is the innermost layer of the sclera, and its name means tainted film due to the presence of melanocytes. This patient had a yet recorded choroidal nevus. This is the anatomopathological image, reported as melanocytosis. Now, we cut the optic nerve head. We proceed to the cleansing of the muscle insertions and the conjunctiva remnants, tenon and lamina fusca, with the help of a moist gauze. This is the final image of the sclera. After being embedded in gentamicin for 20 minutes, it is conserved in glycerin. We have felt that when we are performing this technique, the junction between anatomy and art arises. No doubt medical doctors do not forget the craft work of the beginnings of medicine. We can teach medicine to the next generations only if we feel emotion with our profession. Sometimes we must remember that medicine and anatomy may be an artistic expression. Leonardo da Vinci, Andreas Vesalius, and Rembrandt understood the anatomy as an art form. Medicine is at the crossroads of art and science. We have felt when we are performing this technique, the junction between anatomy and art. No doubt medical doctors do not forget the craft work of the beginnings of the medicine. We can teach medicine to the next generations only if we feel emotion with our profession. Sometimes we must remember that medicine and anatomy may be an artistic expression.